Hey viewers! Are you feeling tired and feverish? Or have your clothes started to fit loosely? Do you know that this could be a cause for major concern? Minor symptoms we usually ignore could be the harbinger of cancer. Early detection helps big time. It makes the treatment much easier and more predictable. In today's video, let's discuss early signs and symptoms your body gives you when you have cancer. Does a change in bowel habits mean anything? What about hoarseness in your voice? We're discussing all of that and more. Before we delve in, remember, don't get overwhelmed if you notice one of these symptoms. There's always a possibility you may have something less serious. Don't delay in calling your doctor if the symptoms last more than 2 weeks. Coming to the symptoms, first up, look out for changes in your bladder habits. When you're well hydrated, your urine will be pale yellow. On days when you're severely dehydrated, it can turn to a deep amber. But finding streaks of blood in it could be a cause for concern. Studies have shown it could be related to bladder cancer. Around 150,000 deaths worldwide are due to bladder cancer. It's more commonly seen in males, so gents, be extra watchful. Doctors call the presence of blood in urine hematuria. Studies also show that it could indicate kidney cancer. It's one of the 10 most common cancers in the USA. Most of the types of kidney cancer are treatable, and thus the death rate is only 2%. And just like urinary bladder cancer, kidney cancer is also seen commonly in males between 60 to 70 years of age. But a change in urine color is not always associated with cancer. If you have beets, berries, or fava beans, then it's also likely to change, plus a few medicines can affect its color. Likewise, deeply colored urine could indicate cancer of the liver. Keep in mind that dark-colored urine is also related to jaundice. The deal with the urinary system and men's health does not end here. Elder men may experience obstruction while peeing. It may or may not be associated with urgency in going to the bathroom. These signs indicate enlarged prostate that often points to benign or malignant prostate cancer. Tumors that usually grow slowly and have less rapid spread are termed benign or non-cancerous. Whereas malignant are the real dangerous ones. They can destroy healthy tissue rapidly and spread anywhere throughout the body. But that's not all. Even changes in your bowel habits can be an indicator of cancer. Your diet usually dictates how regular you can be every morning. It gets quite tricky when it comes to differentiating between cancer and constipation. It's all right if you don't empty your bowels in the morning every day. Everyone's going to have a different pattern. Some might prefer doing their business in the afternoon, and that's completely all right. But if you feel constipated for days on end, then it would be best to see your doctor. Diarrhea for a couple weeks and fresh bleeding while passing stools could also be a sign of colorectal cancer. Your doctor may do a colonoscopy to rule out piles, hemorrhoids, irritable bowel syndrome, and harmless polyps. Want to know more subtle signs? Get a closer look at your skin. Who doesn't love beach vacations? Getting that natural tan might add to your beauty, but it can be harmful. Exposure to UV rays can double your chances of cancer. It may begin as a minute skin change that you'll hardly notice. Keep watch on the size, shape, and color of any regions that get exposed to the sun. Redness can indicate skin cancer if it lasts for weeks. If you find the redness vanishing slowly, then it was just a rash. The same goes for warts, moles, and beauty spots. Seems like they don't add much beauty after all. If you see them growing larger than 6 millimeters, then it could indicate melanoma. Imagine a pencil eraser. It measures roughly 6 millimeters and gives you a fair idea while you eyeball the lesions. Also, if these patches turn brownish black, have ragged or blurred borders, and look asymmetric, then it would probably indicate that it's time for your medical examination with your skin doctor and rule out the possibility of cancer. It's easy to miss small cuts if you're involved in a lot of physical work. But if you have unexplained bruises and wounds on your body that are taking forever to heal, then it could again indicate skin cancer. Did you know that the changes in your skin can point out other cancers as well? We are talking about breast cancer. It's time for the ladies to listen up closely. The occurrence of breast cancer in males is pretty rare. The female body is constantly undergoing a change right from puberty to pregnancy and from childbirth to menopause. All of the stages of life are possible only because of hormonal changes. The problem starts when there is a hormonal imbalance. At times, the whitish discharge from the skin around the nipples can be completely normal, but if you come across a tinge of blood, then you need to see a healthcare professional immediately. It's one of the earliest presentations of breast cancer. Puckering or dimpling of the skin over the breast could also indicate that something's not right. If you find the skin above your breast to be red or warm upon touching, then it could also indicate hidden breast cancer. Extreme dryness should be on your radar too. It could indicate plain dryness or breast cancer. But hang on, you must never rely on these signs alone. This deadly cancer has other hidden markers too. Breast cancer has gripped the entire world. There's a likelihood of 1 in 8 women developing this life-threatening disease. Any bumps, nodules, and hard lumps should not be ignored. Regular self-examination can rule out the risk associated with the treatment when cancer has already reached the final stage. Don't just look for asymmetric breast size, but check your armpit and your collarbone area for thick, hard nodules. These lumps may or may not cause pain depending on whether you're benign or malignant. Speaking of pain, is your headache hiding something? A simple, throbbing headache could also mean that cancer has already started growing in your brain. Studies have shown that migraines and tension headaches can degrade your quality of life drastically. They not only can bring limitations on your social abilities and reduce your work efficiency, but also hide a brain tumor. According to the same study, people who developed brain tumors had a prior history of migraine. But don't worry, headaches have other causes like poor sleep, bad hangovers, exposure to too much noise, bright light stress, and poor posture. Let's talk about the pain while swallowing. It's all right to pass off sore throats during the winter as something trivial. Infections, cold, and flu generally subside within a couple weeks. But if you encounter unbearable pain, even with a single sip of water, you might be in for esophageal cancer. There might be a possibility of a tumor sitting in the throat that exerts pressure on the surrounding area while you eat or drink. Initially, you'll find it difficult to swallow solid foods. As cancer spreads, swallowing liquids will also give you a tough time. Another early warning sign could be a persistent cough with a dramatic change in voice. Your usual pitch of speaking may feel altered. This is one sign that most smokers ignore. Don't hesitate to get it checked by a doctor as it could indicate lung cancer or esophageal cancer. But don't confuse this condition with dry mouth. If you are already dehydrated or taking medication, your mouth will be extra dry. This makes it difficult to swallow food due to a lack of saliva. Your mouth is a mirror of your overall health. Stand in front of the mirror and observe your lips, tongue, gums, palate, and inner side of your cheeks more carefully. If you see white patches, one of the things that it could mean is leukoplakia. This is a precancerous condition that most commonly goes undiagnosed. With time, they can even turn reddish-gray patchy and hard. It's generally seen in tobacco chewers and smokers, but it's not a rule of thumb. It could happen to anybody who's not addicted to tobacco. If you're vigilant enough, you can stop it from becoming a gruesome bit of oral cancer. A few oral infections resemble oral cancer. When you fail to pick up early signs, you're missing out on early treatment. An early freedom from the dreaded disease. Wounds inside your mouth heal much faster than other injuries. But when you have cancer, it's completely different. Be extra careful of wound healing after getting a tooth pulled. According to studies, an oral wound that doesn't heal even after a month clearly indicates oral cancer. Want to know what else gets added to the list? Fatigue and tiredness. These can be temporary companions when you're overworked, don't get enough sleep, or are undernourished. However, if you experience low energy for long periods without any particular reason, it could be alarming. Experts consider this the first symptom that people usually fail to pick up. Cancer fatigue symptoms cannot be washed away with a cup of coffee. It's also quite different from the tiredness you may feel after staying up with your baby all night or exercising too much. It has a devastating effect on your output at work and even personal relationships. Leukemia is a type of blood cancer that could be the root of your weariness. It usually causes anemia that goes hand in hand with fatigue. Stomach cancer can make you feel exhausted to a certain extent, so don't skip those yearly checkups and blood work. Fever also can foretell if you have cancer. Every house has its own remedies when someone starts feeling feverish. It can include anything from over-the-counter medicines to herbal teas. Your internal thermostat takes a hit if you have cancer. It's not always scary when your body temperature goes above 98.6 degrees Fahrenheit. Your body can handle temperatures up to 100.4 degrees Fahrenheit. Anything more than that is considered dangerous. But if you find yourself feeling too warm continuously, it could mean your body's trying to fight cancer at some level. Night sweating also could be a red flag indicating cancer. Last but not least, unexplained weight fluctuation completes our list. Are you making focused efforts on training rigorously or have started a new diet plan? If you're not trying to make lifestyle modifications and still seeing your weight go haywire, then visiting your healthcare professional should be considered. Most times, it can be nothing serious, but it's always best to get every tiny symptom checked by an expert. The American Cancer Society specifies a drop or gain of 10 pounds in 6 months as a grave problem. You can prevent cancer if you're well informed about what food to never put in your mouth again. Let's keep the conversation going with a couple more videos related to foods that may cause cancer, shall we? Watch 12 cancer-causing foods you should not eat, or top 5 cancer-causing foods you should avoid. Go ahead, click one, or better yet, watch both and learn more about how to keep yourself cancer-free. Do you know any other symptoms of cancer? Let us know in the comments below.